CCs, all the officials from the county government, officials from national government, our partners led by Lance Brooks, who is the Chief Biological Threat Reduction Program of the U.S. Department of Defense. Wananchi, hamjambo. Kwa hivyo mimi, I just want to say that what is happening today fits very, very well in our journey to provide quality, affordable health care to the people of Isiolo, which is the promise I gave to these people 2017 during the campaign. I remember we said, I am a doctor, my deputy is a medical doctor, the speaker is a laboratory person, therefore there should be no reason why we should actually be judged in our performance in health sector, as much as we'll do well in others. I hope today, with the help of partners and also our own initiative, a partnership has come that has really changed a very, very dire situation. Because I remember this lab, there was a photograph of a toilet which was circulating in the social media about the state of our lab. I don't know whether you remember it. Wale wanaangalia social media, ilikuwa naangalia ni hospitali yetu na choo vile ilivyo. That toilet actually is in that lab. It's just the way that toilet was actually a picture, a true picture of what was happening at that time, because we didn't have equipment, we did not have reagents, we did not have staff to run that lab. We had 6 laboratory technicians or technologists. Today, with the partnership of the US and our own initiative, I want that, as stated by Mr. Brooks, that this is a true partnership, because we looked at what the US government equipment was bringing and what was deficient. We made sure at the same time we put in our own, so that this lab is completely at state of art. I think today we can be very proudly saying that Isiolo laboratory is even better than the one of Nairobi Hospital. And it's true. It's very true. Sasa hata ukiwa Nairobi ni muhimu uje Isiolo ukitaka kupata correct diagnosis, kwa sababu all the equipments, any equipment you want, kama ni ya kupima damu, kama ni ya kupima choo, kama ni ya kupima mate, kama ni ya kupima kitu chochote ya kupima kwa lab, hakuna kwa hii lab leo. Nusu imeletwa na wadhamini, ile pengo ilibaki, sisi pia county tumeongeza. Hakuna kitu chochote hii lab leo inakosa. Lab imetengenezwa pia, ukuta imetengenezwa, imekuwa safi, imefanywa biosafety controls, imewekwa. Huwezi ingia hiyo lab sasa bila ujue code ya kuingia ndani. Pia tumeongeza wafanyikazi. We have added 11 extra laboratory technologies so that there's no shortage of staff in that lab. Kwa hivyo leo tumesonga na tumepiga hatua kubwa mbele. Sababu kama hakuna lab ambaye unaamini, unajua lab ingine ndani ya hii town unaenda unapimwa, kila mtu ako na typhoid, kila mtu yuko na malaria, kila mtu yuko na amoeba. Leo tuko na lab ambaye ukiambiwa uko na amoeba, kweli uko na amoeba. Kama unaambiwa uko na malaria, kweli uko na malaria. Kama unaambiwa uko na typhoid, kweli uko na typhoid. Hapana tu ya kutengeneza pesa. Kwa hivyo hakuna haja nyinyi napoteza wakati ndani ya hii town. Lazima muje msaidike hapa. Tunataka UHC ifanye kazi, na UHC itafanya kazi kama daktari iko ya kukupima, lab iko ya kupima damu na choo na kila kitu, dawa iko, na mimi naona bado changamoto ya dawa haijaisha. Na mimi nataka kusema nikiwa hapa ya kwamba jameni, mambo ya KEMSA kupitia Ministry of Health officials, kama iko hapa national officials from Ministry of Health, I think you need to take this message back to Waziri. I have even spoken with her. Tomorrow I am meeting her and I will tell her again, this business of approving our orders to KEMSA by the Ministry of Health headquarters, it takes time and it delays our orders to the extent that there is gap in the availability of medicines. Therefore, please, can the approval happen at KEMSA so that whoever is approving at Afya House should move to KEMSA and approve it there, so that our requests for medicine do not take 3 weeks, 4 weeks, so that between that period there is shortage of medicine and we hear a lot of complaints here. Kwa hivyo hiyo ndio maneno nataka kusema kwa national government. Ya pili nataka kusema why I said this facility is adding to our journey is because Isiolo is one of the counties with the highest, or one of the counties with not so good health indicators. When I say health indicators, we are talking about maternal mortality. Ours is 790 out of 100,000 births. Infant mortality is 154 out of 1,000 births. We are one of the counties among the 25 counties that contribute to the 26% malnutrition in this country. We have a distance between facilities that is 49 kilometers against the World Health recommendation of 5 kilometers between health facilities. So it means we have a lot to do to reverse these health indicators, bad health indicators. And today, this journey, this incident or this occurrence, this facility that we got today in collaboration with the US government will take us several steps towards reducing those bad health statistics. My strategy is that we start, number one, with community health service. That is the number one approach to reverse these bad health statistics. And that is why, as a medical doctor, I am committed to partner with Living Goods so that they work in the rural areas. They have added technology to the knowledge. Each community health volunteer is having a smartphone with an application that alerts the community health volunteer that today, house number Y, the child needs to go to immunization. House number Z, the mother needs to go for the third or the second antenatal care visit. Today, we're supposed to give health education in village X against, or to teach people on how to prevent diarrheal diseases, or what are the causes of TB and how they can be prevented. If we strengthen our community health strategy, then that becomes the number one defense and the number one strategy to reverse these negative health statistics. Then, number two, after that, that is level one. After that, we are improving our rural health facilities. Last year, we built 7 more dispensaries. This year, we are in the process of building 7 more dispensaries. In these 2 years I've been in office, we have built 14 dispensaries. That way, we are reducing that distance of 49 smaller and smaller, so that we have more facilities, and therefore people can access health facilities without traveling that long distance. Also, at the same level, I am partnering with Philips, and I am happy to announce here that we have now gotten, with the aid of Netherlands government, a transaction advisor. Why? We want to go into public-private partnership for those rural health facilities. And Philip will inculcate private culture of efficiency, of youth stretching the shilling longest, while still they make their profit. I am sure we will get the best service in those rural health facilities. We are going to pilot with 15 dispensaries. We are going to follow the law. We are going to invite the PPP unit of the Treasury to be with us. We have already invited Ministry of Health, Dr. Mugambi and a certain doctor. 2 of them are already with us in that negotiation. And we now have a private company called Referral, who is paid for by Netherlands government to advise us so that we get the best deal for our people. So that those after the community health initiative, then the rural health facilities also provide the highest possible quality care for our people. Then at this level, level 4, level 5, we now are today celebrating one of the greatest milestones, where we have now achieved the highest possible service, or the best possible service at the laboratory for our people. This is a teaching and referral facility. Therefore, we have now built, in the last 2 years, we have built medical training college. It was just in this office before, you know. Now we have, from scratch, we have built 6 classrooms and 8 offices last year. This year, we are building a 2-story, 2 blocks of 2 stories for men, 2 stories for female, so that the students who are being accommodated out there in town can now be accommodated here, so that our college now can be fully operational. Next financial year, we are building the administration block for the teachers, so that now the college is complete. And this laboratory will add a lot to the quality of teaching that is happening at this college, because we will have laboratory technicians, laboratory technologists, and other laboratory professionals being trained here over and above the high-level biosafety teaching that will happen here. We have now the CT scan, which is now a state-of-art facility, which we have just opened a few months ago. It's not operational because of, I am told, there is a printer. And I want the CEC and the chief officer, I want this printer issue to be sorted within this month, please. So that this facility is not just by name. We have a very, very expensive state-of-art facility and building and equipment here. It must start serving these people within this month. If it's not, let me know why, so that we can push even with the wazir. Okay? So we have now changed, we are slowly therefore changing this mortuary. I am sure you know how it was when we came. Now we have put a new, 4 new coolers, or whatever they are. The chambers now are fully functional, and the bodies now are well preserved. You will not hear the smell along the road that you hear, and it is functioning very well. The wards will be, we have now also put oxygen plant in this hospital and in Garbatula, and piped it to every bed. And right now, our patients, including newborn and even in theater, are receiving oxygen, which we used to get from Nairobi, and sometimes we run out of it here, and our patients will actually die because of lack of oxygen. Therefore, now that one is fully functional. It's brand new that we just put last year. So, we have revamped the psychiatric unit. We have now started cancer screening center. The dental unit, we have now put a brand new dental chair that is already functional with a dentist. And therefore, this hospital, therefore, is slowly coming out to become what it's meant to be, a teaching, a referral hospital for those rural health facilities that we are revamping. Therefore, this is the journey we are in terms of health, and we have come a long way, but we still have a long journey to cover to make sure that Isiolo County Health Services is the best in the country. Among the 47 countries, that is our target, and we will work very hard. I want to appreciate my staff, the chief of staff, the CEC, and all the staff of the hospital, and I really appreciate the work you are doing. The laxity and the lack of motivation is slowly wearing out. These improved facilities, I just saw the lab guys, they are all very happy and smiling because it's not just about money, it's also the environment of work. And I'm happy and I'm very thankful that you are able to contribute to the happiness of my staff as they serve their people, because that environment now is a state-of-art facility with even a place for them to work, to have a bit of rest and have tea, while also they care for the patient, which is also a very clean environment. So, I want to say that sisi tutaendelea kufanya kazi, maneno mnasikia ni mingi, lakini kazi inaendelea. Hii ni maneno ya afya leo tunaongea. Maneno ya maji tutaendelea kuongea, mtakuja kuongea siku nyingine maneno ya maji. Maneno ya barabara mnaendelea kuona. Juzi tumeitwa kufanyiwa audit, hiyo ni kawaida. Hakuna mambo mapya pale. Tumeitwa na magavana wote 47 watapitia waulizwe maswali. Na mimi sitaki kuongea mambo mengi. Hiyo budget ya audit ni ya mwaka 3, 2015-2016, 2016-2017 na 2017-2018. Na tumepewa wiki moja ya kumaliza madokumenti yote. Kwa hivyo kama unaona wafanyikazi ya treasury hawako, ni kwa sababu zamani tunafanya kazi ya mwaka moja, audit ya mwaka moja. Mara hii tunafanya audit ya mwaka 3. Kwa hivyo ndio maana lazima tumalize hiyo kazi yote, tupelekee Senate. Kwa hivyo hakuna shida hapo. Na nataka kusema ya kwamba serikali yangu tutafanya kazi kwa wananchi wa Isiolo. Na nimeamua ya kwamba sisi tutafanya kazi. Na kazi nafikiri inaonekana leo, hii ni mmoja yao. Hii hospitali mnajua vile ilivyo. Sasa mumeona MTC vile inaendelea. Munaona lab vile inaendelea. Munaona ndani ya hospitali vile ilivyo. Obviously kutakuwa na upungufu wa madawa hapa na pale. Mtu akikosa tupa na doama, akikosa dawa kidogo, isiwe sasa ni nduru na hakuna kazi tunafanya. Kwa sababu hata Nairobi Hospital ukenda, kuna wakati utakuwa na upungufu hapa na pale. Hata nyumba yako kila wakati huwezi pata kila kitu. Kwa hivyo lakini lazima muangalie nyuma vile ilivyo, na muangalie sasa vile ilivyo, na muangalie vile tutakavyokuwa vile tunaelekea mbele. Na mimi nafikiri mbele iko sawa sawa, na tunaendelea kuhakikisha hii county iinuke, na baada ya miaka 5, hii ni miaka 2 peke yake. Tukiangalia mambo ya elimu, kwa miaka 5 iliyopita madarasa 30 ya ECD ndio lijengwa. 30 ECD classrooms in 5 years. This year we have built 34. In 2 years we have built 34 classrooms for ECD. And we are partnering also. In every step we partner, because we have to extend our shilling the longest it can go. And in education we are partnering with UNICEF And we are very happy about that partnership. Our young children are now, the preschool kids are now receiving the best care because UNICEF has assisted us with state-of-art teaching materials. Abacus, our kids get now the same kind of training using materials that anywhere in the world the children are using. So slowly we are moving. Na mimi nashukuru vile nyinyi wananchi wa Isiolo mnavyoona na macho yenu. Kwa sababu kuna watu wanasema tuamuke tufanye maandamano. Vijana wanaambiwa tuamuke tufanye maandamano. Kina mama wanaambiwa tuamuke tufanye maandamano. Na mimi naona watu wa Isiolo wanakaa tu. Hiyo ndio ile furaha niko naye kwa sababu mnaona kazi vile inavyofanyika. Na muendelee, wacha mniangalie vile ninafanya kazi na maendeleo, maongeo pia lazima iendelee kwa sababu wengine wanalipwa kuangalia sisi na kuongea juu yetu. Mimi ninalipwa kuwafanyia kazi na kuonyesha kwa macho. Kwa hivyo wacha tuendelee ili muone ndio tuweze kuamua baada ya miaka 5 kama tumefanya kazi ama hatujafanya kazi. Ama namna gani? Kwa hiyo machache nasema asante. I want to really thank our partners. You have really enhanced our journey and we have arrived faster than we would have without you. Thank you very much and God bless you. Thank you.
Meanwhile, while there's renovations going on,
Cut it together. 1, 2, 3. Very good. Very good.
So you stand on this side?
Yeah.
You stand here?
Very good. So we pull it, isn't it?
Yes, we pull it.
Okay. Very good. Very good.
Very good.
Asante sana.
You're welcome.
Very good.
We'll access. Okay.
Biological safety cabinet class 2.
So this is a new facility?
Yeah, this is
Okay, very good. And this is a new microscope?
Yeah, no, this was there for processing a microscopy. Because in microbiology, sometimes require incubation.
All right.
Thank you, Better.
That's good.
Let's go.
They are all doing the same thing?
All doing is and then so the inside machine here. This one is now, it has reduced our time here, turnaround time
From 1 hour?
from 1 hour to